And we will continue with Thomas Beiswenger and back pain. Ich habe Rücken. I suffer from back pain. Well, during evolution, we have really started walking on our fours, and we used to walk upright, but the evolution is actually returning back because we're always looking at our cell phones, and this is why we're all suffering from back pain. So this is a widespread phenomenon. How effectively can EMS help to treat back pain? And this is the topic for Thomas Beiswenger. He is a sport and physiotherapist. He is a natural healer and an osteopath. So he combines many, many disciplines. He has a very holistic view of all of the treatment possibilities. And his point of departure is a Waldenburg Institute study. It is an interim summary for diastasis recti. Do we have any Swabians here in the audience? Hanseverzogen, they say. So what can you do after diastasis recti? This was your point of departure, and the study then actually brings you to EMS and the possibilities to treat back pain with EMS therapy. Thank you very much. Well, my name is Thomas Beiswenger. I work as a teacher and as a lecturer at the vocational college in Waldenburg. And today I want to give you an overview of the therapeutic aspects of EMS, what are the possibilities EMS offers, and the aim is, of course, to treat back pain. And I will summarize it and actually try to paint a bigger picture to show you the wide variety of possibilities for treatment. The initiative Safety First is an excellent initiative because I, as a therapist, as a one-on-one therapist, have always had a problem with those group training approaches because I usually work with a person that has a concrete deficit or a concrete problem. And this is why this one-on-one approach is perfectly normal for me. And starting with one-on-two already causes a problem for me because I feel that I'm not therapeutic enough. So we said, fine, the EMS therapy, where does it stand? We do neither the classical electrotherapy nor classical EMS training. We are basically somewhere in between the two. So we take the relevant therapeutic elements from local EMS, transfer this to whole body EMS, and then integrate what the fitness market already does ever so well, and that is working with the client, with the customer. So we've created a wonderful link between classical prevention and classical therapy. We actually said to our students, if we speak of EMS in therapeutic terms, who is aware of this? You saw the phytogram study probably that looks at EMS training. This is sensational. We said, okay, but there's also therapies, and where do we stand? And since we come from southern Germany, we said, okay, we will pick 15 postcode areas with 334 practices and made telephone interviews and asked who is familiar with EMS, who's not familiar with EMS. And as a therapist, you would think that everyone I actually made a telephone call to knows EMS because electrotherapy is known. But what was striking for me was that almost half of the people I interview were unaware of EMS, but should have known. And of those who are familiar with EMS, only 5% of the people surveyed are really using EMS for therapeutic approaches. They train with it. They provide training. So what we know from fitness, the training with EMS is done by therapists as well, although they have a therapeutic equipment in hand. So only 30% use it for therapeutic uses and 70% use it for training. And when you then go on to ask, what do you do in therapeutic terms? And 39% said orthopedic disorders, and it was back pain, it was scoliosis, it was prolapses, etc., and progresses. And then these 30% of the therapists really come into their own. And what was most interesting was, okay, does it really work in therapies? 80% said they were successful. So when they do it with their patients, it works. It works fine. Only 50% are familiar of the therapists with EMS. 5% use it. 30% of the 5% only do therapeutic things, and it works. 80% say it works. So I am wondering what's going wrong among my colleagues. The fitness market does not have any prejudices. They simply try it out, they find it works out, and then they actually increasingly use it. The therapists know why it should be working and still don't use it. So this is a problem, but this is a problem we can solve. So the fitness sector should think more along therapeutic lines, and the therapist should think more along fitness lines. So we're looking at an old history. Let me show you the chronological occurrences to describe why the state of affairs 2017 in FIBO is basically an old story that is only instilled with new life. Over the past 10 to 15 years, we've hardly seen any studies on the effectiveness of the therapeutic use of electrotherapy, let alone whole body electric therapy. So everything done in therapy today is new, is breaking new ground like 15 to 20 years ago. It's quite exciting, but I enjoy this because I can, of course, play around with things. The fitness sector, and this was taken out of the Fitogram study, shows that the EMS market is constantly growing. So we've got 190,000 people training with EMS per year. But let's now look at the medical rehabilitation using EMS. Then we're talking about over 1.6 million applications for rehabilitation measures, and the approved rehabs are well over 1 million. So there's a potential of 1 million therapy customers who have that need. 1.6 million have applied for it. Just imagine the market potential that is held by the therapy market. This therapy market in the long term is definitely far more interesting than the fitness market, because the older the people get and the longer they have become accustomed to the wrong behavior, they become patient. Sooner or later, we will get them. This is my motto. This is what I always tell my patients. I always tell them, I only have to wait for long enough. You will suffer some pain sooner or later. This unspecific back pain, 90% of all Germans actually suffer from this type of vague back pain. This is a patient, and this is a therapy then, therapeutical work. And if I can then differentiate between a neurofascial problem, a prolapse problem, a neurological problem, and can then actually offer adequate solutions, great. I have served my market perfectly if I know how to do things, that's for sure. So there is so much ground, there's so much potential, and we are still unaware of the potential, of the opportunities. We start with individual areas that we focus on. not we alone, but there are also other service providers. And we're trying to slowly but surely introduce quality into this market. Why? Well, let's look at one example. We look at one disorder connected to back pain, and this has to do with pregnancy, and this is the diastasis recti. So the belly muscles don't close again, and this is why the tension in the belly is low. And we said, okay, this is a problem we're familiar with, and if we then actually apply therapeutic criteria for EMS therapy, would this work? Yes or no? Do we actually produce an effect for these patients, these female patients? And if I then find out in the study there is an effect, then as a second step we do a pre-study. Yes, it works. And then I can say, well, how do I have to set the standards so that a therapeutic training really makes sense and works? That's the next step. So first of all, we have to find out, does it work or not? The whole study situation in Germany hardly focuses on therapy. It's always training at the bottom, even at the heart clinic in Bad Oeynhausen. It's secondary prevention. It never, ever is the term therapy mentioned. Does this mean that we're not even allowed to treat patients? Of course we are. We just have to prove for which patients it works and for which it doesn't. The whole situation that Sebastian Autenried, Stefan Müller, and Jens Vatter have summarized in the book can be actually mentioned here. There are effects, but nobody has really dared to treat a patient. So we are really doing groundbreaking work beyond what has started into 2002 with treating incontinence or the body transformer back then with low frequency, etc. What did we do? Well, we got hold of girls after giving birth, 24 ladies, and we said, okay, when you have this diastasis recti, how big is this cleft? And then let's change some of the parameters, apply a different frequency. Let's select another frequency that you can hardly feel so that the muscle is twitching slightly, and you do nothing. You just lie down. We simply adjust power and wait for 20 minutes, and that's it. So EMS doing nothing, so to speak. Then we looked at the cleft with ultrasound to see the change between before and after, and several minutes later. And the results were outstanding. We wouldn't have expected this because we didn't have a feeling at all for what would happen. The orange bar is the measure above the navel, the green bar below the navel, and in the area of the structures above the navel shows over 1 centimeter of cleft change, up to 2 centimeters. Up to 2 centimeters, you would say pathological cleft if the cleft increases. And of this cleft, we moved back to normal within 20 minutes, just 20 minutes, whereas the patients were lying flat on their back and didn't do anything. So you can imagine what would happen if you actually deliberately train the pelvic floor or core stability or whatever. Logically, the results would be even better. Maybe this logic arrives in the second or third stage of the study, but at least based on this little pre-study, we can say assured that in this area, EMS does the trick. It works without any physical exercise. And now we can say, fine, let's look at the effect it produces on whole body stability, on back pain. So there are things moving now, and that's good. So if I want to take a therapeutic approach, I cannot but integrate EMS in my therapy. This does not mean that the therapist is the better applier or EMS trainer. No, but the therapist can make the results more efficient as part of his therapy. So he has now gotten a tool to produce an effect, maybe not doing anything in addition. And at the same time, the fitness-focused person can say, maybe there is a possibility of actually gaining a new clientele, a new customer base. Maybe I can bring in customers to training where I used to say before, this is a counterindication. Unfortunately, I cannot train you. And now I can tell them, yes, if I change the parameters, if I actually factor in safety first, I can treat you now. So this is the direction we're headed because it's joint saving. We don't have to talk about it. The market has clearly shown this. The point is simply to actually create added value on top of this. And this is the therapeutic approach. I can actually use it for any type of therapy, and I can also use it for improving mobility and balance. Like in competitive sports. So I can always adapt it to my client. So the range opportunities is a lot bigger. And depending on what I can do, I would focus on fascia, I would focus on core stability, and I would add this on top to increase my efficiency, widening my target group. What would this look like? Again, I also brought along videos. Maybe my videos will work. This is my personal surprise now. We actually changed several parameters. What did we do differently? Well, you can see the green tapes here. It's not spectacular, this plastic bar that we're lifting here. But we said, okay, we're looking at the superficial backline from the myofascial segment and actually change the position of the electrodes in such a way that they're not circulatory, but that they're following the myofascial chain. So from the bottom, along the backside of the thigh, all the way down to the Achilles tendon. And whenever the on phase starts, Johanna actually enters into this myofascial chain, but gets active, and through the power impulse gets a more targeted input into the chain. You could also include the sole of the feet. You could also include the neck. Makes no difference. So there are various possibilities of working with this. Then, of course, the correction situations. I can also work against the power impulse, the electric impulse, and I can basically do what I want. Then I can also use this for improving mobility by saying, well, if the electric impulse is arriving, then I will actually flex or extend this chain, and I will actively fight the impulse, actively fight the contraction. So I provoke an extremely strong sliding of the fascial layers. So with less input, I achieve far better mobility of the myofascial system. And I can transfer this to any other muscle chain. I can transfer it to joints if there's, for instance, impaired mobility. So there are many, many possibilities to actually solve a myofascial pain problem in the back. And this is what we then work out with various postures, depending on the gravity of the problems. So we actually extend versus or against the contraction. And you simply have to be aware of what you can do going beyond the usual spectrum you cover. What else do we do above and beyond? Of course, we're trying to analyze what effects EMS application produces, whole body EMS and the impact on holding and support muscles. Excellent results, superb results. Then we also made some tests with type 1 diabetics. Then we said, okay, let's focus on the myofascial area of the lumbar section. Then we also looked at other data. So we work in many different areas by way of experiment and then try to use this knowledge for further training and continuous education. The various modules, therapeutic modules, and the users then tell us, well, I know medicine, I have a basic medical knowledge, and then I can actually use these therapeutic tools and actually attend these seminars. For those of you saying, well, oh, medicine, this is too hard for me, I'm happy when I understand Latin terms. We said, okay, for those we also have an offering. And what we do is we build on the known fitness level. And Glucker is doing ever so well with the various training modules. And we then actually add on this medical therapeutic knowledge, trying to turn the good fitness user into a small therapist and the good therapist into a small trainer, strength trainer. And of course, as you can't do this on your own, we also have cooperation partners, and this gives us an excellent synergy to really push on EMS where it should be everywhere in the practice, in every practice or surgery that looks at the health of humans. Well, thank you very much for listening attentively. Enjoy FIBO and bon appétit, and see you later. Bye-bye.